Good afternoon, everyone. Thank you so much for joining us. I'm Becky McGregor, your Employee Wellness Coordinator, and you have come to the Employee Benefit Presentation, Your Benefits Unmasked, with Blue Cross Blue Shield. We have on the line today Lisa Guevara from from Blue Cross Blue Shield, New Mexico. And we're just thrilled to have you all here to listen in on this presentation for your 2021 benefits. We also have Ann Johnson. She is our Senior Benefit Analyst. She is in the chat box, and she's going to also assist with questions. And I want to just give you guys a couple of house cleaning items. If you can, please, when you are listening through the presentation, to keep your phones and computers on mute. It just limits the distractions for everyone, including our presenter. And also turn off your cameras. Now, as we get to the Q&A section of the presentation, we may ask you to unmute just to clarify your question or get more context around it. We do ask you put your questions in the chat box, and we do have a Q&A portion of the presentation today. So you may put it in the chat box, and if it's something that Ann can answer or something that we might just note to get answered more fully from Lisa. So I just want to make sure that you know we will keep those questions in the queue so we can help everyone. Again, I want to thank you all for joining us, and I'm going to toss it over to the lovely Lisa with Blue Cross Blue Shield. We're thrilled to have her, and here you go.
Thank you, Becky. Good afternoon, everyone. My name is Lisa Guevara. I'm with Blue Cross Blue Shield, and it's a pleasure to be here this afternoon. We're really excited to continue to be one of the partners with APS. And I just wanted to start off by thanking all of you. With a child in school, I can appreciate everything that all of you do, whether you're a teacher, administration, whatever role at APS, we do appreciate you. So thank you and kudos to all of you. I'm really excited about sharing with you today a little bit about Blue Cross Blue Shield and more importantly, what it means to you for this upcoming enrollment effective January 1st. You can go ahead and move forward, Becky. Today, we're going to talk a little bit about the Blue Cross Blue Shield plan features. There are some streamlined benefits that you'll notice will be changing for you. Additionally, we'll also discuss online tools, resources, health and wellness, as well as our customer service department, which is located right here in Albuquerque. Go ahead, Becky. So a little bit about, you may notice, this currently within this year for 2020 and the last several years, you will, you're probably familiar if you're currently a member that there is a 3-tier benefit, meaning that you can seek services from our Blue preferred providers, Tier 1, a Tier 2 doctor, or a Tier 3. You'll notice that for 2021, one of the biggest changes APS has implemented is that they look to streamline our benefit plan designs and make it a little bit easier to understand. So for this upcoming year, effective January 1st, your plan will only have an in or an out-of-network plan. So this is called a preferred provider organization. So when you utilize in-network contracted providers with Blue Cross Blue Shield, and we're going to discuss exactly what those are, particularly in the Albuquerque area, when you use those in-network contracted doctors, you're going to receive the highest level of benefits and potentially have the least out-of-pocket expenses whenever you're seeking services. In addition to that, you also have the benefit of having a discounted rate that we work very strongly on your behalf with all of our providers, particularly for those benefits that you are paying a percentage of. That can mean huge savings for you. But also, it protects you when you see a contracted doctor for any charges that are above our usual and customary, meaning that we have an allowable amount, which is an average in the area. And if those services that he or she are billing for are above that dollar amount, you are never responsible for those. So it provides you that protection from balance billing, as well as you will never have to file any type of claims, nor would you have to get any referrals from Blue Cross Blue Shield to seek services perhaps from a specialist. It's important to realize that many specialists require a courtesy referral amongst physicians, but once again, that referral is not from the insurance company or Blue Cross Blue Shield. It's just a courtesy amongst them. With this plan, you still have the flexibility to make the choices of where you seek services from. You do have a level of benefits if you choose a physician or facility that may not be Blue Cross Blue Shield PPO contracted. But I just want to let you to be aware that when you do decide to do that, you may have a larger deductible, resulting in a greater share of the costs that you receive. In addition, you may have to file your own claims. You may be responsible for any charges that are above our allowable amount, as well as any type of prior authorizations that may be required. Maybe it's a surgery or an inpatient hospital stay. It becomes your responsibility to obtain those authorizations rather than the physician. So that's a little bit about how the PPO plans work. Again, on the next slide, Becky, you will notice that your network of physicians, when you choose Blue Cross Blue Shield, is the largest network, PPO network available in the United States as well as worldwide. Over 1.2 million providers, or 95% of doctors, or 96% of hospitals are contracted with Blue Cross Blue Shield. In the Albuquerque area, that includes the Loveless Health System, with the Women's Hospital as well as the Heart Hospital, UNM Hospital, UNM Physicians, both primary care as well as specialty, Optum Healthcare, as well as the Loveless Medical Group, are all part of your Blue Cross Blue Shield PPO contracted provider network. But in addition to that, your coverage does not leave when you leave the state. Your coverage is nationwide throughout the United States as well as internationally. Some of our more well-known facilities that are Blue Cross Blue Shield contracted and part of your network include the Mayo Clinic or MD Anderson Cancer Center. Those are some of the examples of the contracted network that is available to you. And again, once you use those contracted providers, your expenses are going to be lower. So on the next screen, Becky, you will notice for 2021, there have been some changes to your plan design. Again, you no longer have the Tier 1 or Tier 2 or out of network. It's only your nationwide PPO network as in network, or again, you still have the access and the benefit to see non-contracted providers. There are many services that have a predictable copayment amount or no charge at all. It's very important to realize that your preventive health services, this includes your annual well woman exam, your annual physicals, maybe it's your children's well child checkups, including immunizations. There is never any charge to you for those, and there is no deductible. In addition to that, our virtual visits through MD Live, both for medical as well as behavioral health, those are also available to you at no charge with no deductible. It's important to know that when I've mentioned virtual visits and MD Live, and we'll talk a little bit more about them, that has become a critical part of your health benefits. And we're really excited that APS has recognized that for the past several years, and the utilization of this benefit is growing tremendously, especially during our current pandemic. In addition to that, there have been some changes to your copays. Whenever you see a primary care doctor, it will be a $30 copay, while a specialist doctor will be $60. It's important to know that with a copayment amount, that is a set dollar amount that you would pay during your visit, and all charges related to that visit would be covered at 100% by the plan. Something else that you will notice that has a copay now are your labs, x-rays, and EKGs. You'll notice that there is now a $30 copayment per day for those services. If you're in need of any type of advanced radiology, such as MRIs, PET scans, or CAT scans, whenever you go to a freestanding imaging center, you have that predictable copayment amount of $120 per day. But please be aware that if you have, for instance, an MRI or a PET scan and it's done at a hospital, you are then having to meet your deductible as well as a percentage. So that deductible is $1,000 for an individual, effective January 1st. After that deductible has been satisfied, you would then be responsible for 20% up to a maximum of $5,000. $5,000 is the out-of-pocket maximum for 2021. When we discuss out-of-pocket maximums, it's important to realize that that maximum is not a maximum on your benefit, but it is actually your protection. It protects you so that between your deductible, any co-payments that you pay, as well as your 20% co-insurance, any of those services, and you pay out of your own pocket, when they reach $5,000, you will then, as a patient, be covered at 100% for all of your care until December 31st. So once again, the out-of-pocket maximum is not a maximum on your benefits, but it is your protection in the event that you have a catastrophic year. Perhaps it's an extensive inpatient hospital stay or maybe multiple outpatient surgeries. It always protects you so that the healthcare costs for that given year never exceed $5,000. Thank you, Becky. See, visits through MD Live, virtual visits. I'm sure many of you may have heard that buzzword, whether it be virtual visits. When we discuss, can you hear me now? It seems like all of a sudden
Yes.
I went on mute.
Thank you.
I'm like, wow, what happened there? So virtual visits. Virtual visits, I'm sure many of you maybe have heard during the pandemic about accessing care through telehealth. Telehealth is visits with your current physicians that are contracted with Blue Cross Blue Shield. Telehealth is virtual visits with that network of physicians. In addition to that, you also have access to our MD Live network and application where you can meet with a MD Live physician on your smartphone, or maybe it's your laptop. It's available to you 24 hours a day, 7 days a week, and there's no out-of-pocket expense. So I really encourage you to take a look at, perhaps if you haven't already tried a virtual visit, to maybe take a look at this. Again, there's no out-of-pocket cost, and they're able to treat you for many minor medical ailments such as allergy, ear infections, headaches, insect bites. You will be meeting with a licensed physician in the state that you are visiting from, and that is important because they are eligible to be able to prescribe you a prescription if necessary and send it electronically to your local pharmacy for pickup. So once again, they're able to assist you 24/7 with minor ailments, but in addition to that, you also have behavioral health services. So if you would like to speak with a counselor or a psychologist or psychologist, they are all available through our MD Live network, and they could assist you with situations such as depression, maybe it's anxiety. We just want you to be aware that this is a resource available to you 24 hours a day at no out-of-pocket cost. You can go ahead and forward on to the next two slides, Becky. We're moving on. There's so much good information in these sessions, so I want to make sure that we leave an opportunity at the end for you if you have any questions that have not been sent through the chat box yet. But once again,
did you want me to stay on the nurse line? Did you want to kind of go through that, or just want me to go to?
I could go to the nurse line. Yeah. Okay. I just want to mention really quickly that additional resource that is available to you at no cost is our 24-hour nurse advice line. These nurses are available to assist you with any questions that you may have, and the telephone number is located in the back of your ID card. So again, just making sure that you're aware of all the resources. Now, if you've tried those resources and perhaps maybe you're new to Blue Cross Blue Shield and you are interested in locating a new contracted provider with us, we have worked together with two of our larger medical groups. They include Optum and Loveless, and they have a new, well, not necessarily a new, but they do have a provider finder service or a concierge line where you can contact them and they will assist you in locating and scheduling an appointment with an available Blue Cross Blue Shield contracted doctor. You could go ahead and move forward. Now, if you're still needing assistance, whether it be in locating a contracted provider, or perhaps you have a question on one of your claims or how coverage would be for a particular service, please feel free to reach out to our customer service. Our customer service is located right here in Albuquerque. We have a dedicated telephone number right for APS. You'll find it here on our slideshow, but it is also represented in the back of your ID card as well. You can go ahead and move forward. A little bit about our online tools and resources. You may ask, there's so many resources available to us as Blue Cross Blue Shield members, but how do I access them? You access all of your information, whether it be personal health history, claims that have been submitted on your behalf, locating contracted providers, or links to all of the resources that you have as a Blue Cross Blue Shield member. They all start at our Blue Access for Members website. And the Blue Access for Member website is bcbsnm.com. There, together with the ID number that is located on your ID card, you can set up access to your personalized website. What's really nice when you do go through your Blue Access for Members, because it is your personalized website, it already knows what network of physicians are available to you, and it will automatically show you those doctors that are contracted for your plan. You can go ahead and move forward, Becky. I know that Becky is sharing with you links to your APS HR website, and on there you will find a copy of this presentation. So if you would like to have a nice feature navigation of all the different features that are available through Blue Access for Members, you can find it there. You can go ahead and move forward, including how to locate contracted providers. This gives you information on our provider finder. You're going to find information as far as where that individual studied at, what medical groups are they with, what hospitals can they utilize. But also, you're able to access this information on our mobile app. Our mobile app for Blue Cross Blue Shield is free of charge. You can download it through Apple or through Google Play. And if anything, you will always have the convenience of your smartphone and having access to a provider finder, as well as an electronic ID card that's right available on your smartphone, where we keep everything nowadays. But in addition to that, you can also look, because some services you do have to pay a portion of the bill, you can go ahead and look up costs of common services for various contracted facilities in the area and see exactly what your out-of-pocket cost is estimated at. You could go ahead and move forward, Becky. As I had mentioned earlier, our Blue Cross Blue Shield app for mobile devices is free of charge. You can receive that and download it at Google or Apple Store. And now we're going to talk a little bit about our health and wellness features of the plan. The number one question that we are always asked during our presentations are in regards to our fitness program. Our fitness program with Blue Cross Blue Shield, you have access to a network of facilities throughout the United States. And the beauty of this program is that for a single fee with no contracts, it goes month by month, you have access to multiple gyms throughout the United States. If you want to go ahead and move forward. A new feature of the fitness program is now you have 3 different levels or plan options, and dependent upon the plan option that you select will determine the network size that you have access to. In addition to that, it's not just our traditional type of gyms. They also have yoga facilities as well, and many of these facilities are also offering online classes. So once again, I encourage you to take advantage of this great fee, this great program. It's a minimal $19 initial fee, and it's a month-by-month program that is based upon the size of network that you are interested in. if you would like to move forward. I would also like to mention to you our Blue 365 member discount program. Through the discount program, you have access to discounts for services such as Skechers, Johnson & Johnson products, a multitude. If we have, I could speak to past experience when we used to have our fun walks. There were discounts to those fun walks if you wanted to register for one. So I encourage you to take advantage of that. When I go to Skechers, I show them my Blue Cross Blue Shield ID card, and I automatically receive a discount. So that's just one example of the discounts available under the program. And the last program that I do want to mention to you is our Ovia program. Ovia Health is access to your maternity and family benefits. It's an online program that will assist you if you're considering getting pregnant and starting a new family or currently pregnant. It assists you through that pregnancy. It has direct links to our maternity case managers. It has alerts on there. If you're at high risk, it automatically triggers one of our nurses to outreach to you. So that's one of the new programs that we have available that we're really excited about to share with you. And lastly, I just want to share with you a few smart consumer tips that we've talked about today and how to get the best value out of your plan. And the first, of course, is by utilizing in-network providers. In-network providers, you're going to have the least out-of-pocket expense. You're having the convenience of not having to do the administrative legwork, as well as you're going to have lower deductibles and lower co-insurance. It's important that you utilize your provider finder to utilize and to search for these doctors. Also, utilize your online resources such as Blue Access for Members, where you can review your EOBs. You may find an EOB for a claim that was submitted to us that maybe by no fault of the physician was submitted under your name and error. All of those types of activities and being a conscientious consumer assists us in making sure that we are able to provide to you through the benefits at APS, the most affordable and convenient, high quality program that you deserve. And if that is it, I appreciate your time this afternoon. If you have any questions that perhaps were not addressed through the chat box, I think we would be happy to answer them now. Is that right, Becky?
Yeah, we do. We have some questions. I believe Anne answered one pretty thoroughly, so I'm going to skip over that just to make sure. Andrea Garcia asked, is this for Presbyterian? No, Andrea, this is the Blue Cross Blue Shield presentation. The Presbyterian presentation was this morning, but these presentations are going to be on the APS YouTube channel, Expect Great Things. It's on a employee benefit open enrollment playlist. I was going to get that link for you and put it in the chat box as soon as I can. But they are up now for last week, the overview webinars. So these will be up by tomorrow afternoon, Friday. You know, we have to give our wonderful communications web team some time to turn these webinars over. So once we finish, they'll be turned in, and then hopefully all of these webinars will be up on that playlist as well by tomorrow afternoon or Friday morning. So just so you guys know. Do you have chiropractic and acupuncture coverage? If so, is it combined benefit, meaning 25-year-old combined? And what is the copay? So that's from Jennifer. Do you have chiropractic and acupuncture coverage? And if so, is it a combined benefit? I'm not sure I understand that part of the question, but Lisa, you may.
Yes. If you don't mind, let me just bring up that portion of it really quick so I can address that for you.
Okay, do you want me to switch back to that slide for people?
It's not listed on there.
Okay.
It is listed on our plan summaries that are posted to the websites now. And but we do.
I'm sorry, go ahead, Lisa.
Go right ahead.
Lisa talking about the Blue Cross Blue Shield sheet. Those are on the plan summaries for Blue Cross Blue Shield are in the process of being posted on that aps.edu human resource benefit website. They're literally working on that right now for us to get that updated.
Yeah. But those services are available to you, and they are combined, the chiropractic and the acupuncture.
What is the copay?
It is $30, and it is a maximum of 25 visits per year. And it's a combination of acupuncture, chiropractic, massage therapy, and rolfing.
Okay. Awesome. Okay. All right. Catherine, you know what? I'll make sure and note your question, and we can talk about it after this presentation on what other options you might have. And Anne answered another copay. Oh, she answered that. Okay. I'm going to keep going down this list. Kristen asked, my daughter will be attending college in California, so would she be covered under Blue Cross Blue Shield while out of state and just need to find in-network providers in San Diego?
That is absolutely correct. Thank you for that question. If you log on to your Blue Access for members, or you visit our webpage at bcbsnm.com and go to our provider finder, listed under the PPO network, you would just input either the zip code that she'll be residing in, and it will bring up a listing of PPO contracted providers within that area, and she would have the same copayment amounts as if she was seeing a local New Mexico PPO contracted doctor.
That's a great question. Thanks for that, Lisa.
It is.
Jennifer asks, is that if I have Blue Cross Blue Shield now and I'm using a chiro and acupuncture services, will the visits reset in January, meaning I will have the 25 available again?
That is correct. Your visit limit is on a calendar year basis, and so they start again every January 1st. So make that appointment for the 2nd.
I know. We all can use it.
We all need it, right?
Yeah. All right. And she's just awesome.
She's busy.
I know, she's busy. Did you say this presentation will be available tomorrow? Okay. Tomorrow afternoon, like I have to turn them in this afternoon when we get done. So Jennifer, please give us a little bit of grace on that. I'm going to turn them in this afternoon, and I hope that they'll have them available within 24 hours. So tomorrow afternoon to Friday morning. We do our best to get that stuff turned around, and the web team is awesome. But just give them a little bit of wiggle room on that. And is there a side-by-side listing of the changes and features from last year to this year? So Alma, we do have something from a presentation. I'll see if I can get it real quick and print and pull it up for you. But I don't know that will help you. But I can find that little grid and show it to you really quick. But I think the thing that's going to help you really for next year is going to be looking at the comparison grid and the plan summaries for next year. Not really looking at what you have now, but I'll get that for you, and I'll get that while we answer this next question. Okay, so Yolanda had a question. Lisa, I don't know if you see that in the chat box.
I do see that. Massage therapy is a covered benefit. It is combined with your, as we had just discussed, with your chiropractic care. Whenever you have those situations, if you've contacted our customer service and you did not get the resolution you were expecting, please do not hesitate to outreach to your benefits department at APS. We work together with Becky and Anne and all of the ladies and gentlemen in that department to help address questions just like that. So I would suggest, again, if you haven't contacted customer service, to do so. If you are not satisfied with the outcome, please come and visit, or give them a call, I should say, to the benefits department, and they have direct access to me, so we can help get you those answers.
Great. And I am getting that grid pulled up for you all. So I just want to give me a second here while it renders up for you. And I will get that. You know how everything takes longer?
It's paint drying, right?
Yeah. Like watching. It's true. Okay, here we go. Let me share this screen here as soon as I get it. And I will share it. And can you see it? Oh, this might need some.
Yeah.
Okay.
I'm sure it's coming.
It's coming. See, it's
There it comes.
Okay, so here's this comparison that you were asking about.
Mhm.
It's a little bit hard to read, but I wanted to go back to the person who asked that question to make sure we have it for them. So here's that comparison. And these slides will be available on the open enrollment page. We haven't put all of these up yet. We were waiting to do the webinar. So the actual slides will be actually available for you to view as well. So this will be up on that open enrollment page. Not the benefits page, but the open enrollment page. And that's just because of technical reasons, really. And I will make sure and make a note of that so I can send that to you if you need it and you want to kind of dial into it a little bit more. We can do that, okay? Okay, Alma, you know what? I'll send it to you, all right? I'll make sure I make a note to send it to you. Okay. And do we have any other questions?
This is Lisa. I just wanted to let Yolanda know if she can share any of the billing statements that she has received with the benefits department.
Okay.
We can have those addressed for her.
Okay, I can do that. Yeah.
You're welcome, Yolanda.
Thank you so much.
Yeah, and if we haven't received the bills, then we'll outreach to your doctor and have them get submitted to us so that you can get reimbursed. You may have to get reimbursed directly from the physician, but we'll see what took place, okay?
Yeah, basically what happened is I just ended up paying it out of pocket. So the only thing I have are the receipts that show that I paid her.
Okay. So we may need to outreach to the doctor to get them to submit those claims to us so that they can reimburse you. Okay?
All right,
And
thank you.
Lisa, I'm sorry, this is Ann Johnson. I just have a clarifying question on that. My understanding is that massage therapy is covered for medical issues when it's like recommended by a doctor, as opposed to I just have a kink in my neck and I feel like I need a massage. Am I correct?
Right. It has to be medically necessary, deemed medically necessary. Yes.
Okay.
As
So-
with all services.
Yeah. So Yolanda, it may be that the reason your particular massage therapy was not covered is it doesn't meet those guidelines.
Okay.
And that is a possibility, but that's something that we can do that research for you and
All right.
find out exactly.
Okay, thank you.
You're welcome.
Okay.
But yes, and you're absolutely correct. All services under, regardless of the medical plan that you are enrolled in, must be deemed medically necessary and meet that criteria.
All right. Did we get to all the questions in the chat? Yolanda, I just needed clarification if I put that in the chat box for you. I think we got to the questions. Can you believe that?
Nice.
Did we? If there's somebody that hasn't had their question answered, please, please, please let us know. Okay. All right. I think we got to them. So I'm just going to move forward. If anything comes in while I'm doing the wrap-up slides, you all know you can absolutely just put it in the chat box. Today's webinar schedule is over. This is our last one for today. But tomorrow we have our financial wellness webinars at 7:30 with ASI Flex, 11:30 with Newsenda Credit Union, at 12 o'clock with the education plan, and 3:15 with the standard. And all of those links can be found on the main open enrollment page, which I've given you. And again, the link is here. So all of those links are there for tomorrow's webinars. Also, just a reminder, open enrollment is completely online using your Winocular workspace system. This is a familiar system for you. They've done just a fabulous job honing in that process. We are still going to have webinars just helping you through it and showing you a tutorial on Monday, October 5th and Tuesday, October 6th. The times are 7:30, noon, and 3:15, like I just stated. And we will, again, those links can be found on the open enrollment page. But we'll walk you through it. You'll see it's pretty easy process for you. We are going to have a wellness walkthrough event on Thursday and Friday, October 8th and 9th. And I just want to mention that this is a hand sanitizing, mask wearing, socially distanced walkthrough event for you to receive some preventive health services, as well as assistance with the online enrollment process should you need it. So we're really hoping that people attend the webinars and realize how intuitive it is, and you can just then do your open enrollment anytime on your own between October 7th and October 14th. But we will be there with laptop stations should you need it. And we also have vaccination clinic going on, and all the information regarding the vaccination clinic is on your open enrollment page. It has a special vaccination page you'll see there, and we just ask that you bring your Express Scripts card or your medical plan card if you're under a different plan. And we also ask that you fill out a consent form ahead of time because that helps expedite the line. All that information, though, again, is on that open enrollment page. You do not have to make an appointment with the vaccination clinic. There may be a socially distanced line for that, but we'll see. We do have mammograms and a blood donor drive with free COVID antibody testing. Those you do have to make an appointment for, and those links to do so are on the open enrollment page. We ask that you please don't come to City Center and let all your coworkers and colleagues know. Due to public health orders, we really can't help you here. That's why we're trying to host this event on the 8th and the 9th at Bonifacio. And if people do need assistance, we'll be there in a socially distanced, hand sanitized, mask wearing way. So we just want to make sure that you all know about that. And we are raffling for prizes for people who attend these webinars because we certainly appreciate you taking time out of your day to learn a little bit more about your benefits and get your questions answered. So thank you for that. And we want to thank Lisa for joining us from Blue Cross Blue Shield and for all the great information. We do appreciate it, and we appreciate all you attending. And thanks to Anne for being this awesome resource in the chat box. And that concludes our presentation. Does anybody else? We're good. That concludes it.